Well, hello everyone. My name is Karen Russo. If you haven't met me before, I'm the Dean of the School of Health Sciences, and I want to welcome all of the students, the faculty, the staff, the administration, and our guests that may be watching us on our YouTube Zoom to the annual Desmond Tutu Public Health Awareness Lecture. This lecture was founded after AIC had the pleasure of hosting Desmond Tutu here on our campus in 2010. As many of you know, Reverend Tutu was key to the anti-apartheid movement in South Africa. He worked hard across his life to attain and support human rights for all and was awarded the Nobel Peace Prize in 1984. He believed that you should do your little bit of good where you are. And it's those little bits of good put together that can overwhelm the world. Since that time of his visit, AIC has held an annual public health presentation to raise awareness around pressing health issues and health disparities, as well as the work that's been done in our area to address these needs across our region, our state, and our nation. Unfortunately, this event has been paused for the last couple of years due to the pandemic, and we are so happy to be able to hold this event once again in person. It is our pleasure to host Dr. Robert Roose, Chief Medical Officer of Mercy Medical Center, as our speaker this year. Dr. Roose has been affiliated with the Trinity Health of New England Regional Health Ministry since 2013, having also held positions of Chief of Addiction Medicine and Recovery Services for Trinity Health of New England and Vice President of Behavioral Health at Mercy Medical Center. In his current role, Dr. Roose has led the health system across the COVID-19 pandemic and worked endlessly to promote the health and well-being of all citizens in our local community. Dr. Roose earned his Doctor of Medicine and Masters of Public Health degrees at George Washington University of Medicine and Health Sciences in Washington, D.C. And he completed his residency at the Montefiore Medical Center and Albert Einstein College of Medicine in Bronx, New York. He's also a graduate of the University of Illinois at Urbana-Champaign, earning a Bachelor of Science in Physiology. The goal for Dr. Roose in all of his endeavors is to help transform care and improve operations so that all people can receive the highest quality of care, when they need it, where they need it, and how they need it. He will be speaking today about the prevalence of loneliness, the impact of the pandemic on social isolation and mental health, and how we all can enhance connections to help us heal as individuals and a community. So let us all welcome Dr. Roose to the stage.
Well, thank you, Karen, and thank you to AIC and to all of you here today and to everyone watching at home or wherever you may be watching. It's a real honor to be here this morning. It's quite a legacy of great work and education that happens here at AIC, and to be part of this month and to be able to provide some information that will hopefully carry forward some of the legacy of Desmond Tutu. It's a real privilege. So thank you for the invitation, and I'm very, very excited to be here today. And it's really great to be here, and I mean that specifically. It's great to physically be in this room with you all today. I think we should give another round of applause for that. Here we are. It's been a couple of years since we were able to have an event like this, which I know many of us have longed for. And it's really a great sign of many things. And that's what I'm going to be talking about today. This is a sign that we are emerging from what has been a very devastating pandemic. It's reassuring in many ways, although we know there are always going to be things that we carry forward and lessons from that and ways to keep ourselves safe. It's validating that we're here today about all the efforts that have been put in to address the COVID pandemic. But I also think it's really great to be here in person, and it's not just because we've been waiting for this moment, but because it's really important that we gather together. In fact, it could be said that it's not just important, but it's meaningful. And I will argue to some extent that it's healthy today. We, in a space like this, are able to foster and cultivate connections, if we are open to it, perhaps in a more meaningful and full way than we were if we were not able to gather together in person. That's going to be the focus of what we talk about today. Everyone here, and I think those watching, are here because we are invested in and really interested in what we can do to promote and support health for all, public health, social justice. And what we know is that there are many different public health crises right now. We know that there have been increasing rates of mental illness, anxiety, depression, stress, the experience of trauma, that has been overlaid upon many other crises or challenges in communities, some of which are depicted through the images there. Things like environmental exposures to toxins, pandemics or infectious disease, medications or addiction, particularly to things like opioids, tobacco, alcohol, obesity, and so on. But I think about how all those things are related a lot as I think about public health. And somebody that I have looked up to and learned a lot from is our current Surgeon General, Dr. Vivek Murthy. When he was appointed to being Surgeon General back in 2014, so now it's been 8 years, he spent some time away and has come back into that role. He wrote in a book that he expected as the nation's doctor to go out and to talk to people and address the issues that are listed here: smoking, obesity, diabetes, asthma, etc. But as he went out and he began talking with people in communities and asking them a simple question, as the nation's doctor or as a public health expert, how can I best help you? He started to hear different things. It wasn't just about those medical illnesses. He would talk to teachers who would talk about their students seemingly becoming more disconnected because they were always on digital devices or were utilizing social media. He would talk to workers in Flint, Michigan, who were going through an environmental crisis with contaminated water, and was listening and hearing that they felt as a community, as a people, abandoned. He went into communities and met with families of people that were struggling from loss. In one case, a 62-year-old woman whose husband had just died from cancer, who was now living in a house for the first time alone since she was a young child with her parents, struggling to make ends meet. And he also talked to a lot of communities where he met with families and individuals that were struggling with addiction. In one case, a son dying of an overdose, and the family remarking how even after that death, nobody came to their house to wish them condolences or wrap their arms around them for support. They felt alone. You might be wondering what I'm doing here today, also talking about loneliness. Loneliness was what Dr. Murthy was hearing in those conversations as a thread throughout so much of people's lives. Abandonment, feeling isolated, feeling alone. And it connected to so many of the other public health problems. Well, I too, when I started listening as a physician treating addiction, that this was something that was impactful in people's lives, and I started to hear and recognize was something unique and a phenomenon all to itself. So I'm an addiction medicine physician, and I spent time in the Bronx, which is shown there, treating patients, also here in Western Massachusetts, as you can see, the city of Springfield. And I've met with and treated tens of thousands of patients at this point, most of which struggling with opiate addiction, oftentimes heroin, but certainly medications as otherwise. One of the individuals that I treated for a long time, as reflected there, is a man named Junior. He's at the time, about a 32-year-old Puerto Rican man who was living in the Bronx looking for opiate treatment. And he had had a life full of trauma, unfortunately, that left him disconnected from very much. And ultimately, he found opioids and violence as a mechanism for him to cope with his life. When I met him, he was seeking care and had already realized that there were other aspects to himself as a person and ways to connect to others in the spirit of service and find some meaning that had him on a path to recovery. But he's just representative of so many others right here that don't have faces shown, that have dealt with similar challenges and felt that deep sense of loneliness or isolation. People that have lost jobs, with fractured families, in disrespectful or shameful relationships, in prison, or people that have been marginalized or stigmatized. So I, too, through my times meeting with patients and families and treating them, felt a similar sense that Dr. Murthy did. A connection that we need something bigger and greater to help us heal from the interweaving threads of loneliness. Now, there's a pretty famous TED Talk that's out there by somebody named Johann Hari, who has also wrote a book. And he actually went on to say, as he talked about addiction in this talk, that the opposite of addiction is not sobriety. It's human connection. And he describes much of what I've been telling you about in the threads of loneliness through many people's lives, and how connection and the lack of connection can certainly exacerbate or make that worse. But I want us to reflect on this for a moment, because today, when I heard this initially, I thought there was a lot of truth to it. I've come to realize that this doesn't paint the full picture. It may not give the full realization of what addiction is or what connection is. Because it would follow, if that was the case, that the opposite of connection would be addiction. And that doesn't always follow in that same reverse direction. What we do know is that recovery from addiction, people need meaning, and they need a sense of responsibility and connection to other things that are greater than themselves. But as I've come to listen and learn and look into the study of loneliness, what I would actually say is it's the opposite of connection is loneliness, or the opposite of loneliness is connection. And what can we do about it? This, I would argue, is the public health, or one of the public health crises of this time, of this decade, or at least one of the most significant public health influencers of this decade. Now, it may not be just as simple as loneliness and connection as being opposite. So I want to explain that just a little bit more. Loneliness really is the subjective feeling by somebody of a lack of connection. Some mismatch between expectations and what reality is. And I'll talk about that in a moment. It's social isolation, as a slightly different term, that is the objective lack of a social connectedness to other people. So the counting up, the quantification of connections, and whether they're few or many, could describe what social isolation is. Now, I want to pause just for a moment, and I'm going to just ask us to be honest with ourselves in a moment where we have no judgment. But who in this room at some point in their life, if by a show of hands, has ever felt lonely? Thank you. I don't think people acknowledge that very often, but that can have a real meaning to know that virtually all of us have experienced some sense of loneliness. And with that experience, we're not alone. And there's other ways that we can get through that. Myself, different points in my life, loneliness meant different things. As a teenager, I think it meant being misunderstood, feeling like you didn't have a place to belong. As an adult, going through challenging circumstances in my life, it felt like I wondered if I had all the support that I needed to be able to persevere through a really significant challenge, personally. And for each of us, it can be different. When we talk about this from an academic or a semantic or a definition standpoint, I want to recognize that everybody's alone at times. Just being alone doesn't mean that somebody's feeling lonely or feeling isolated. In fact, and me and my wife have regular conversations about this, having some alone time can be a very beneficial and positive thing. It can be something that you choose. It can be something that's voluntary. It can be something that's very much desired and quite beneficial. It's about how we spend it and whether or not it's something that is desired or not. Loneliness is the subjective, so the feeling in which there's a discrepancy between what our preferences would be and what our relationships are. That is negative. Even when we're around people, you can feel lonely. And as I'll explain, has been shown to lead to some pretty negative health outcomes in and of itself, even when controlling for some other factors. And then there's social isolation. Social isolation is just the quantification of the connections that people have. So few, some, many. People that are socially isolated have objectively few social connections and have very few, limited, or in some cases no, meaningful relationships. Just to be socially isolated doesn't mean that you're lonely. Just to be lonely doesn't mean that you're socially isolated. You could be lonely with many people around you all of the time. It's about whether or not it's meeting your needs and with the quality and the meaning behind those relationships. So, a researcher by the name of Mary Ellen Copeland has spent a lot of time looking into this and put together what's called the Loneliness Workbook, which is a real step-by-step program to help people assess their own levels of loneliness and some strategies to help combat it or work through it. And in that book, she asked people and then commented, "What does loneliness mean to you?" And I don't know if anybody here would be so brave, maybe to offer at any point in their life what loneliness meant to them. Please. Thank you for the courage to be able to say something. Really, you articulated something really important there. You've talked that as an experience, losing somebody, and then feeling a void and a craving to be able to connect with them and not being able to. So that mismatch between what you as a person feel like you need and would like and the inability to do that is exactly a description of loneliness. Thank you for the courage to say that. It can feel like this to some people, a pain or a hole in the heart. It can feel like being a lost soul, misunderstood, wondering if anybody there would even notice if you were gone. It can feel like carrying around a vacuum inside, something feeling empty. And in some cases, it may not be as severe or dramatic, but it may feel just as uncomfortable, just as if life just could be richer if I had better relationships, and I feel lonely. Loneliness means different things to different people, as it should, which means that we must recognize that when we think about how we ask about it or would address it. It's described, I think, in many other different adjectives, like despair, at its most perhaps significant, emptiness, incompleteness, being devoid of love, longing for human contact, or being abandoned. And I'm sure there are others. From an academic standpoint, there are ways that researchers measure loneliness. So many of you here, if not all of you, are students that are in here to learn and educate and understand the science behind how we determine what issues are of most importance and then how we can address it and whether or not the things that we do have a positive impact on behaviors or attitudes or practices or health outcomes. Some researchers at UCLA back in the 70s, so it dates back to 1978, created a loneliness scale to be able to begin to measure this. And here are 20 items. It has been revised a couple times since 1978. A few of the questions were flipped so that they were not all just negative statements. And there's a rating for each statement that an individual filling this out would determine if they often, sometimes, rarely, or never experience these statements or these feelings. And I bring it up because we're going to talk a little about this as we go through. As we look at something like this, keep in mind, and as you read the statements, and I encourage everybody to just read them, it's quite commonplace that people experience these from time to time, if not frequently. So answering rarely or sometimes to 1, 2, 3, 4, or 5 of these statements doesn't mean that somebody's experiencing profound loneliness. But taken together, you can think about it as a range, with a scale from about 20 being actually relatively low on the loneliness scale to being as high as 80 would be the maximum score. So you could, over 40, 50, 60, experiencing significant levels of loneliness. Some of the studies we'll talk about later used sort of a mid-range of about 40 to 45 in terms of whether or not somebody was lonely. I just want to, as we look at these, I imagine many people here, including myself, have looked at them and said, yes, at times I have felt one or more of these items on this scale. The higher the score on these scales, it does relate to some pretty important outcomes, and that's why the measurement becomes a tool. Higher loneliness has been associated with having fewer and not as meaningful friends and relationships. It's been associated with some other demographic factors, like being in a lower socioeconomic status. It's also associated with things like having burnout in your job, having chronic illnesses, and being more sedentary than being active. Again, loneliness starting to connect to many other things in our lives. As you look at this, you could imagine how many people may feel lonely from time to time. This is really a crisis with significant magnitude. Using the scales like that, researchers out of one of the main national health insurance plans, Cigna, did a study recently of over 20,000 Americans. And we looked at many different types of studies. But just to look at these moments for a minute, that 47% of adults in America sometimes or often are feeling left out. 46% sometimes or often are feeling alone. 43 sometimes or often feel their relationships are not meaningful or isolated from others. And then some lower percentages, but some significant still numbers of the amount of adults who feel like there are people that don't really understand them or close to them or have people that they can talk to. These numbers and the magnitude of this have been replicated in many other studies. So in 2018, Kaiser did a study, and it showed that 22% of adults often or always feel lonely. That's 55 million people across the country. A study of elders done by the AARP in 2018, around the same time, showed that a third of all adults, actually in this case it was adults over 45, so not elders, but middle-aged and older, a third of all adults felt lonely. And although the slide is loneliness in America, it's not only here in the United States as well. I want to highlight that there are studies that have been replicated in Canada where 20 to 25% of adults feel lonely at least once a week, 25% of Australians, and a little bit less so, but still 13% of Italians, which could bring up some questions about differences in cultural norms and ways in which people engage and how they also perceive loneliness. But bottom line, there are a lot of people in the United States, all across America and across the world, that are currently feeling lonely. In America, there's 330 million Americans or so, and actually a more recent study showed that 61% of the adults that were surveyed felt lonely. and that's going up. It actually went up from 54% between 2018 to 2019. Some of the reasons why: there are some key determinants or social influencers: not enough social support, not enough meaningful social interactions, poor physical and mental health, and not enough balance, quote unquote, in our lives. The problem is that this is actually getting worse over time, not better. Since the 1980s, loneliness has actually, I say doubled here, but it's almost tripled. The rates of loneliness amongst adults in the 80s was about 20%, rapidly went up to about 45%. Now we're starting to see some evidence that it could be even higher. Could be almost 60% as shown here. We know, and there's a lot of evidence to suggest and back up, that older adults are at risk of the complications of this, oftentimes living alone and feeling isolated, particularly in advanced age, when many people's meaningful connections from the past, their friends and social networks, may have died. And they're now feeling more isolated than before and have other illnesses that could be compounded by that. But what most recently I think is quite troubling, and we're going to tie all this together, is that young adults and adolescents are seeing dramatically increasing rates of loneliness. And actually, the rates in some groups, so Generation Z, almost 80%. Millennials, almost 70%. If you go baby boomers, it's down about 50%. So we're seeing those rates extremely high amongst younger individuals. And also seeing it occurring more commonly in individuals of races other than non-Hispanic whites, in communities with lower socioeconomic status. And there's a bit of a debate. In some studies, it's more men. In some studies, it's more women. It depends a little bit on the age. With younger populations, it tends to be more females that are at more risk of feeling lonely. So this truly is a crisis. It's a crisis with a massive magnitude, as I would say. At least there are tens and tens and tens of millions of people, if not hundreds of millions of people, that are feeling lonely and isolated in the United States alone. But it's all interrelated. Loneliness is not only a crisis of isolation, it's actually a crisis very connected. It's not a crisis in isolation. It is connected to the millions of people that are living in chronic disability or disabling pain, as pain can be something that exacerbates feeling alone. It's happening intersecting with a culture of pills being utilized in many cases to try to treat even mental health conditions or other things. There's a way to sort of cure all ails. It is a crisis that's intersecting with rising rates of depression, anxiety, and trauma. It's one that's compounded now by high rates of unemployment, disconnection from so many other things. And it's also, right now, one that's happening in the context of an explosion, right, of digital technology, social media, in the layers of the pandemic. This intersection, to me, is what makes loneliness such a grave risk for our communities, for any community, because it's going to take addressing many different things in parallel or together to fully address a crisis like loneliness. But we can do it. And there is a lot of evolutionary history and science that demonstrates that humans are a social species. And so we are programmed, if you will, to be able to have a state where we work together. I show an image here because we're all familiar with the adage of birds of a feather flock together. Right? Now there's a lot of truth to that from an evolutional standpoint. Right? We rely as a species on cooperation to survive and to thrive. When we were hunter-gatherers on the tundra, if we were only individuals out by ourselves, we would have a much lower chance of survival than if we figured out how to work together with people. When you figured out how to work together with people, one person could go out and hunt while somebody kept tending to the fire, while somebody else could help raise the children, and you could start to divide labor in a way that a collective community wouldn't call it a society back then, but a collection of people cooperating was really what led to the success of continued evolution of the species. So we adapted. We are cooperative. This begins at a very young age, and it just expands throughout our adulthood, our adolescence, and into our adulthood. And I think there's plenty of evidence that modern humans, us all here, are perhaps the most social species that's ever been in existence. And that's really, it's evidenced by and demonstrated by the fact that we have extremely advanced information, language, culture, very layered and contextual and complex. And how we split up, how we do tasks is all because we work together. So that sense of like rugged individuality like only takes us so far, but we as a community have to cooperate in order to continue to succeed. We've been selected for that. As humans, we didn't evolve because of our strength, our speed, or our size, right? It was because of our ability to cooperate. Any quick trip to the zoo would have reminded us of that. We wouldn't have done very well if we were out on our own, only by ourselves. It's ultimately that social connection, that evolution mixed with our physical evolution that has led us to where we are. I show this a little bit just kind of humorous as we think about the stages of human evolution. We've been evolving over millennia. Each activity that we evolved with, from hunter-gatherers and so forth, relied upon and demonstrated cooperation, even where we are now. But I would ask us, let's look at those last two. Sitting at the desk looking at the computer, or the man with the tie holding the phone. What about now? Is the connection, is the cooperation as meaningful as it once was? What is all this loneliness trying to tell us? What is the loneliness that people are experiencing telling us about how we are evolving and how we are adapting and how we are growing? Well, I'm going to go to the brain just for one slide. Mix in a little bit of the hard science with the social science. This is just a sagittal look at a brain, really just to show and highlight some of the key areas in the brain that loneliness has demonstrated to have impacted structurally and functionally. The sections I just want to highlight are the prefrontal cortex. Those are the higher order functions where they originate. Right? Things like inhibitory control, emotional regulation. Loneliness has shown to impact that part of the brain. In some areas with denser material, in other areas with less dense material, depending on the specific function. The amygdala and the hippocampus intertwined with memory and drive. The reward pathways, things that intrinsically motivate us because of positive reward, or in some cases to avoid aversive or painful or other stimuli. The insula, which isn't highlighted specifically there, but memory and executive function, and it's what allows us to create what we would call like significant emotional moments, like meaning and connection in the ways that we relate to people. That's all being shown now through MRI studies, functional studies, PET scans, that there are differences in brain chemistry amongst those that experience significant loneliness versus those that don't. And that makes sense if we think about this from an evolutionary perspective. There's a prominent researcher, Dr. Cacioppo, who really looked a lot into the evolutionary perspective of loneliness. Let's think about that for a second, right? Why would loneliness, what does it serve us? Why would this make sense that there's so much loneliness? Or why does loneliness even exist? Let's think about it from a basic evolutionary level. We have basic needs, things like food, water, and to be healthy. So we know that we need food to survive. Our bodies have created a signal called hunger, which people feel in different ways. It's mental, in their stomach, but it's a signal that the body then says, aha, I need to eat. It's what's going to keep me going. Now, granted, we could have a whole nother public health talk on how the mechanisms regarding hunger have been rewired and overwhelmed by sugary and salty foods. But at its basic level, you get hungry because you need to eat. You get thirsty because your body's telling you need to drink to survive. You get pain because your body's telling you avoid that so you don't die and you don't do something risky. Well, loneliness has now been conceptualized as a signal, an aversive signal that says, seek out connection. You need to cooperate as a species, as a person. It's important for you, meaningful for you, healthy for you. So when you feel lonely, it should be a trigger to say, get connected, to get connected. The challenge is that sometimes is paradoxical. Because as people feel lonely and lonelier, oftentimes it becomes harder and harder to then reach out and get connected. The brain then can start to go into a self-preservation mode, meaning now everything around me is a potential threat. I am hyper-vigilant for those, and I'm going to become defensive. I don't feel that connected to people. I'm feeling alone. Therefore, now I'm seeing things that are making me feel even more alone. I start to think of, in that case, the FOMO. When you're looking on Instagram, you're feeling one way, and now you're seeing everything there that you think you should be doing that may or may not be reality, but you start to get defensive and you start to feel, and you pay less attention to certain negative social images. The brain then can start to become a little bit more depressive. Self-esteem can be lowered. And so over time, in an immediate sense, loneliness can be very productive and constructive because it tells somebody, I need to connect. I'm feeling lonely. Let me call my best friend. Let me go to the coffee shop. Let me get involved in an activity. Let me play a sport. But over time, if it's chronic, it can actually lead to a paradoxical reaction that can often lead to a negative spiral where more loneliness just begets more loneliness. Decreased resistance to impulsive behaviors, which increase the risk for things like substance use, making sleep worse by many people, having micro-awakenings at night. And ultimately, this is the concern. And physiologically, there's evidence to suggest that this happens with people that are experiencing loneliness over long periods of time. There's a chronic inflammatory response. So cortisol levels start to go up, stress hormones start to go up, and it begins to wear on the body over time. In the brain, there's a reduction of what we'd call brain-derived neurotropic factor, which is a really important protein that's critical for things like thinking, memory, and just overall brain health. And you can start to see changes in the reward pathways in the brain, particularly regarding dopamine. As somebody becomes lonelier and lonelier chronically, those receptors are screaming for input. They're screaming for something to help, to feel better, to feel happier. And these physiologic changes are what now have been shown to lead to some pretty significant health outcomes from loneliness in and of itself. So the impact of loneliness and social isolation on health is dramatic. 50% increased risk of dementia amongst people that are lonely. A 29% increased risk of coronary heart disease, of having heart attacks. 32% increased risk of stroke. People, on the counterpoint, people with stronger social relationships had a 50% higher likelihood of surviving than those with weaker social relationships. This is really what's driving Dr. Murthy as Surgeon General, so many other people, myself included, to really want to focus our efforts on loneliness as a unique phenomenon. Even when controlling for other factors, loneliness was showing that it had 50% increased risk of early death. The value of connections could not be understated. That, for those of you that study or are interested in tobacco-related illness, loneliness has been correlated to be about as harmful as somebody smoking 15 cigarettes a day, and more harmful than obesity to somebody's health and their risk for early mortality. Here you can just see visually how this compares to some very common public health threats and crises. If we look at a ratio for risk for premature death, in an additive kind of a way. If somebody's exposed to chronic air pollution, smog, etc., probably about a 5% increased risk for premature death gets added into the rest of their perhaps other comorbidities. An odds ratio in that case would be 1.05. I've reflected it here as percentages. Obesity increases that risk of early death by about 20%. Excessive alcohol use increases the risk by about 30%. Loneliness increases the risk by 45%. Now, you might be thinking, well, why? Why would that be the case? What is it about loneliness? We talked about some of the physiologic aspects, but perhaps there's some other aspects about why loneliness is so important and such a unique phenomenon and how it can lead to that risk. One of the hypotheses I want to mention is the direct effects hypothesis, which is really one that is, if you think about it, just kind of the direct effect of being lonely. There are less people in your life that may be helping you make better decisions about your health. So somebody may engage in less health-promoting behaviors, more health-compromising behaviors, therefore have worse medication adherence, treatment adherence, and so forth. You know, you may not have that friend to go with you on a run. You may not have that friend who inspired you to take up meditation. You may not have that partner who wants you to eat better, or you may not have that partner who reminds you to go to the dentist. This is some of the direct effects that loneliness can have on people's health, is one hypothesis. Another hypothesis is that loneliness, or connections, depending on how you want to, which angle you want to look at it, is a stress buffer. So having people in your life that help support and assist and can be an ear to listen to or a resource to share can help buffer when you go through major stressful responses. And without that, and if you're lonely, you have less tolerance to be able to manage those stressors, and they can have a greater impact on your own health. So that's the one other way, a pathway that loneliness could lead to risk. And then thirdly, this is a little bit perhaps more indirectly, but with loneliness impacting sleep so significantly, there is a hypothesis that really says that sleep is so important, which we know that it is to many things, memory formation, brain processing, etc., that the impairment of the ability to really benefit from restorative sleep can have a weathering effect on people over time and create higher risk for things like chronic illness and early death and morbidity. So what are the roots of loneliness? We've talked about many of them. As I talk to patients that I treated with addiction and with other medical illnesses, and Dr. Murthy and others gone around and talked to families and communities, we realize that much of loneliness can come from people that have experienced stigma. In addiction, certainly that's very common. People being judged in ways that creates an internalized sense of shame and then lower self-esteem. Loneliness can also be impacted by somebody's experience with trauma, or being marginalized, or feeling like an other, or having society other somebody into a category. Also can be rooted in living alone. And what we've seen over time is more and more people in America are living alone. If you go back to the 1940s, there was less than 15% of households in the United States that were just one person living alone. In the 70s, it went up to about 15 to 20%. And right now, in 2000 and beyond, it's over 25% of households in the United States are just one person living alone across pretty much universally all states now, where it used to be congregated in more urban areas initially. Now it's pretty much across the entire country. So there have also been changes in our work environments, in our studying environments, in our academic environments that have pushed people out from gathering as closely together, and the nearly universal use of what I'm calling, quote, social media. I'll ask if it's really helping, do we think, with social connection or not. We now, over the last 2 years, we've been living in an unintentional and very tragic experiment in some ways, where we've had a pandemic layered on top of an epidemic, layered on top of other epidemics, right? If we look back over the last 2 years, I think it's important to think about how connections have changed and how that may be connected to loneliness. I've just put a few of the things here. There's some images, but I've just put a few of the items that we've all experienced. Lockdowns, closures of schools, the fear of illness spreading to friends or family, being engaged in less activities, being told and enforcing social distancing, which to me really should be a misnomer. We never really wanted to distance people socially. At least that would have been my argument. Physical distancing is one thing. Social distancing is another. Masking, working and engaging and studying remotely. All of these things have occurred, and we've all had to change so many of the different ways in which we've interacted. Less so now, but more so in the last 2 years at various points during surges. You could just very simply recognize that people were making very difficult decisions. We all were. Sitting at the balance of that scale, trying to figure out where we should be in that moment in terms of balancing risks for COVID, which are very real, very significant, have led to tremendous mortality and tragedy and loss, which should never be understated. But we also know now, accumulating, the more that we institute policies to keep people apart, increases the risk of isolation, loneliness, and a disconnection. And that can have some real impacts. I still, in many parts of my day, and I'm working in hospital leadership, and I'm responsible for the operations at Mercy Medical Center. It's a very busy place. I spend most of my days, unfortunately, still, in some respects, trapped to a room. We call them Teams Tuesdays and WebEx Wednesdays because we're just on Zoom meetings for so much of our day, collaborating and coordinating, and it's a very different world. It's intentional and important that we go out and we seek and get to areas of our work and of our community. I know we've all experienced to some degree Zoom fatigue. And right now, fortunately, the risk posed by COVID is much less than it was at various points because of vaccination and because of less severe variants. And so we're able to gather together, and where we end up on that spectrum will change moment to moment or month to month. But I assure you, we've all lived this world. Everything has changed. Has anybody heard this before? I must have been witness to about 10 different encounters of a moment like this just this morning. Can't hear you. Can't hear you. You're on mute. You're on mute. It was the most, I know it's kind of a funny thing, but it was literally one of the most used quotes of 2020 and 2021. What does that say about where our culture has been over the past 2 years? We're constantly just telling people, you're on mute or I can't hear you, and how connected is that really? Right? And how is it to hear that all the time too? You're on mute, I'm on mute. You're like, there's some meaning to this. Quite literally, like we are silencing people or wishing that they were silenced, right? In some cases, you want to click the mute button as quickly as you possibly can, and in others, you want to make sure that you want to hear what they have to say and be heard. I think it's a different way of communicating. In the old days, we were in meetings, and if somebody was chit-chatting on the side, you would hear them. Now, everybody's muted, and you have to intentionally choose if you're going to speak or not. It's a different way of operating, and I think it has some impact. So what do we know about this? What has social isolation looked like during the COVID pandemic? Right? So here's a study across 50 states done by Harvard, Rutgers, Northeastern, Northwestern, 185,000 people. 12 different time points, waves as they called them, of surveys from April 2020 to July 2021. The question in this case was, when you're thinking of your complete social circle of family and friends, how many could you count on for these things? Or how many could count on you for these things? And there are some statements there. If you can't read them, they say to care for you if you felt ill and needed it, to lend you money if you needed to borrow it, to talk to you if you had a problem, felt sad or depressed, or to help you if you needed to find a job. And what's being measured here is the percentage of people who answered there were 0 or 1 person. 0 or 1 person in their entire social circle that could count on them for those things. So, lonely. So, lower in this case is better. Higher in this case would be more lonely. What's interesting here, actually, and to me was somewhat counterintuitive, at least initially, when I looked at this, was that right after the first surge, or when we were getting that pandemic in March of 2020, the isolation actually went down. I think everybody was just like mobilizing, like, what is this and what's going on? And nobody had really felt the impacts yet. But a few months later, all of a sudden, boom, they shot up. So it was actually around June and then into the summer and then over the course of that year where isolation really became quite high. And it hasn't been until the January of the following year, so January 2021, where we really started to see it start to improve again. Very significant. I mean, over 50, you're looking at 55% of people feeling isolated amongst one of these domains. Now, how did it relate? I think this was an interesting question. How did it relate to social distancing or physical distancing? And interesting in that it didn't relate all that much, to be honest. You can see with the green line, that was the average social isolation score regarding the 4 different measures that we just looked at on the previous slide. Drop immediately, get more lonely in isolation, and then kind of level out and start to go down. Now, people that had isolated, you can see here, it doesn't really track all that closely the 2 different graphs, right? They went down together initially, but then things fluctuated and people still stayed pretty isolated, whether they were seeing more people or not seeing more people. There was some lasting impact, I think, early on, that even with some of the social distancing things had an impact on people. And they looked at things like unemployment and if people lost their jobs, and that didn't exactly track related to it either. But there is some discrepancy here, some discrepancy between the reality and the desire in ways to connect that has lasted throughout this pandemic, particularly for young adults. Now, young adults, when looking at studies during the pandemic, have been particularly at risk. Now, it's not surprising. Young adults, and I'm thinking of adolescents, teenage years, 16 and older, all the way to 29 or so. Still, brain is developing. Lots of critical things happening in terms of interpersonal development, maturity, growth, education, figuring out what you're going to do for a career, etc. All of that can be happening during that time for many people. And the impact on youth with a study that was done in the state of Washington showed that there were significant increases in loneliness in youth before the pandemic and then after that first surge. What was really interesting that was found was actually people that had higher social supports prior to the pandemic were actually at most risk of having increases in their loneliness. People that had lower social supports still increased their loneliness, but by much, much less. And I think it has to do with, at least the thought is that you had certain expectations of what your social circles and the meaning that you needed out of your relationships was before the pandemic. And because that changed probably so much, you were at much higher risk of feeling a lot more lonely. People that don't maybe need as many connections to feel fulfilled, maybe they have 1, 2, 3 close friends, and that didn't change as much because of you weren't as involved in all the different activities that got shut down, they were less likely to actually have significant increases in loneliness. So I think it makes sense, although I have to kind of walk it through a little bit. But it certainly has put people at risk of things like depression, anxiety, and suicidal thinking. So I want to layer on, and I'm going to layer it on pretty quickly because this is something that I think a lot of us also know, but this happened, the pandemic, in the context of a mental health epidemic amongst youth that was already in existence. So prior to the pandemic, and even during now, of course, as well, mental health conditions and suicidal behaviors among high school students was increasing. It actually, sadness and hopelessness increased by 40% from 2009 to 2019. You can see that dramatic difference there in terms of sadness, in terms of attempting suicide, in terms of making a suicide plan, attempting suicide, or being injured in a suicide attempt. Significant increases between that decade in every single category. So now we've got loneliness, youth mental health, pandemic, 3 intersecting crises, a 3-headed monster, if you will. Suicide rates have now gone up by 30%, over 45,000 each year. I do want to just highlight this phenomenon of youth mental health is not felt equally. Similar to loneliness, where the roots are often in marginalization and in societal stigma. People that identify as other categories have often felt a much more proportional impact. So 2/3 of lesbian, gay, and bisexual students and nearly half of female students have been feeling persistently sad or hopeless in 2019. And disproportionate are impacted by suicidal thoughts, LGBTQ, at rates that are far higher than those that don't identify in that way, 4 times more likely to have attempted suicide than their peers. Hot off the presses, now looking at that crisis layering on with the pandemic. The CDC actually put out a report last week, so I had to update the slides. This is a study that was done across the country looking at adolescent behaviors and experiences between January and June of 2021, looking at 7,705 public and private students across the country. What the takeaways really here are, as you look at the categories of persistent feelings of sadness or hopelessness, poor health during the pandemic, or seriously considering attempting suicide, students that felt close to people at their school were far less likely to have those feelings. Far less likely. Students that felt virtually connected to others were also less likely than those that are completely lonely, but the effect was a lot less. So the darker blue is the differences of those people that felt close to people at school, and the lighter blue on the other side is those among students that felt virtually connected only. If you were closer to people at school, 28% felt like they had poor mental health versus 45% of those that did not feel close to people at school. So the impact of connectedness is really, really important here. And connectedness in person far greater than connectedness through virtual means. A study done in Massachusetts has reported that over a quarter of adults in Massachusetts reported that they needed mental health care during the pandemic. Again, younger adults far more than others. And you can just see here the intersection of all the different crises. So during the pandemic, the people's needs for services went up. About 20% of those needing services for behavioral health conditions were actually new requests, directly related to, in many cases, the pandemic itself. Here you'll see, just broken down by demographics, that study of the people that needed mental health or behavioral health services, 67% of them were young people aged 19 to 39. 67%. This really is a crisis of young people amidst a pandemic, amidst loneliness. It also is one where there's greater proportions, as I mentioned before, people needing care amidst the pandemic, of those in lower socioeconomic status, those with lower education, and those that identify as other than non-Hispanic white. On the bottom here, I want to draw the attention to the impacts from that study of the pandemic on mental health. So of those adults that needed behavioral health care during the pandemic, during that year, 64% of them said it was related to the pandemic. 11% felt like it was brand new, never had a problem directly related to COVID. And the other 55% or 52% was conditions that they had before were made worse and exacerbated by it. So the layers, again, in the layers. Loneliness in a digital age. I would argue, and it's true, that people oftentimes feel more connected. I imagine if these images feel familiar to anybody, on their phones in class or late at night or outside or at work or connecting through various platforms. I wonder if people are more connected, can they be lonely? Well, in some cases, they can be more lonely. In other cases, they can be less lonely. Anybody remember these commercials? Really briefly? Yeah. So, can you hear me now? Can you hear me now? Can you hear me now? Anybody ever felt the mild frustration of being on a cell phone with somebody and driving through a dead zone and you're like, can you hear me now? Can you hear me now? Can you hear me now? So we make all these efforts. I bring this up just as a counterpoint. We make all these efforts to go to great lengths to stay connected through these means. This commercial shows a great example, and Verizon is just doing their thing to try to show how connected the world is by creating cell phone service in like the wilderness, or in a subway, or in a movie theater, or wherever, at a construction site, as if it's the best thing ever. But there is some cost and there's some trade-off. And I wonder if we're losing something by never, quote unquote, disconnecting, and connecting with ourselves, and connecting with other people in a meaningful way. Because connectedness really is the antidote to loneliness. Connectedness is the antidote. It is the answer, the solution, and the hope. In the study I mentioned before, students that felt close to people at school had a lower prevalence of poor mental health, had a lower prevalence of feelings of sadness, of considering attempting suicide, or of attempting suicide. And very importantly, 66% less likely to experience a health risk related to sexual health, substance use, violence, or mental health in their adulthood. Connectedness is an antidote. And connectedness means that people feel valued, feel cared for, feel loved, feel respected through the relationships that they have. It leads people to make better decisions about their health. It leads people to have a better self-esteem and being happier. It leads people to be more productive in their work and in their life. And the evidence shows that it leads to having a lower risk for early death. Connectedness. So how do we address it? So as students of and people contributing to public health, we must, in my opinion, recognize this as a true public health epidemic. One that takes the framework from so many other epidemics and our response to them by focusing on prevention and then assessing and intervening to provide supports for people to address it. And if somebody is experiencing symptoms, then treat it, to establish a way that our community and society can then build towards sustaining more meaningful connections in whole. It also means addressing the social influences of health, which can often present barriers to meaningful connection. And for our youth, expanding programs to promote social and emotional learning, self-awareness, mindfulness, meditation. There is a curriculum that's been formed that's called Beyond Differences, that's endorsed federally, that has tactics and programs and lecture series to really help develop this. And at a national level, there's also the Commit to Connect campaign, often focusing on folks at the other spectrum of life, at older life as opposed to youth, increasing the awareness about the harms of social isolation and loneliness amongst all segments, building champions across the country to scale up solutions. It's a partnership between the Administration for Community Living and the Secretary of Health at the federal level. So as we close today, I ask us to think about, I ask us all, I'll ask myself, what we can do to improve connectedness in our own lives. And I would consider you taking this and thinking about this later. Ask yourself the 3 questions below, and then think about reaching out to a trusty friend, to a trusted friend, to share your responses and invite them to do the same. Which relationships, communities, or groups in my life really feed me, energize me, make me happier and more connected? Which relationships, communities, or groups in my life leave me feeling isolated or lonely? Perhaps I'm ready to let those go. And what's one thing that I could do to take my current relationships to a deeper level and initiate more conversations that matter? We can do that. Loneliness is real. I hope we've conveyed some sense of the magnitude and the seriousness of this. Connection matters. I will also urge us to reflect on a quote that I heard from Junior, who I showed at the beginning, somebody whose story is now in a documentary called The Fix. He once told to me along his journey of emerging from loneliness and addiction to one of meaning and recovery, that to the world, you are one person. But to one person, you are the world. So today and going forward, in this world of algorithms, Zoom classes, hashtags, followers, don't ever forget the value of a true human connection. We can make a difference. Thank you.
Thank you so much, Dr. Roose. Does anybody have any questions? I know people have to leave for class here shortly, too. Question here?
I could share that with you. Yeah, I can.
We'll share out that documentary that Dr. Roose mentioned. Yeah? Any other questions? Thank you so much, everybody. I hope you enjoyed the event. Oh, great.